From local tragedy to the loss of a Hollywood great, suicide has proven that it really doesn't discriminate. The second most affected demographic is college students.
In the United States of America in the last year, there was 1,100 students that took their life that are college students. And at the College of the Canyons, there was actually 3 students that took their own life. And so our statistics are pretty high compared to other colleges.
Unfortunately, none of those students came to the Student Health and Wellness Center for help or counseling.
What we take from that is that students either don't know about the counseling center or there's a stigma to getting counseling.
What many students don't know is that by paying your student health fee, you receive 6 free counseling sessions and more if needed.
It's okay to ask for help. We're here for students here at College of the Canyons, or your friends, or your students.
Although the Health and Wellness Center has outreach events with suicide prevention for teachers and staff, they also offer mental health first aid certification, as well as online suicide prevention trainings for students. There are signs you can look for and tools you can use to help those you love. Few signs that someone you care for may be considering suicide include feeling of hopelessness, feeling major distress, withdrawing, starting to give their things away, and increasing their alcohol intake. There's one tool Gail and Jerry believe can help save lives, and it fits in your phone.
In addition to the services we have here, we also know that, there are going to be times when you're not available or you're alone or it's after hours or you're just talking to a friend and you need a tool, something to get somebody who's contemplating suicide or having suicidal thoughts connected with help. And so we recommend that every student, every staff, every faculty member put the National Suicide Hotline number in their phone. And that number is 1-800-273-8255 or TALK.
Remember, if someone you care for is having suicidal thoughts, listen non-judgmentally and remind them there's always a silver lining.
You can recover from this. There is hope. There is people that love you, that care about you.
What we're finding is if somebody is communicating about it, if somebody has a hope, then the chance of them completing suicide or going through it are lessened. Talking them through the crisis, that eventually the crisis passes and you have then saved their life. It's temporary. The whole thing is, recovery and to instill hope.
For Cougar News, Felisa Cárdenas.